those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency. We are servicing Miami-Dade, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and welcome to the show, everybody. I'm excited to introduce everybody to Dr. Ryan Snelling. And he is a neurosurgeon right here at and also director of the stroke program at the Marcus Neuroscience Institute. Their phone number is 561-955-4600. Thank you so much for taking time out of your day to come on to the show,
Yep.
Dr. Snelling. We appreciate that.
Happy to be here.
Absolutely. Happy to have you. And so I always like to kind of get an idea of, different doctors' backgrounds.
Sure.
and kind of like, I always want to know, like, when was that moment that you realized you wanted to be a doctor? So where did you go to school, and when did that moment show up for you?
I did my undergraduate training at Vanderbilt.
Nice.
I was in biomedical engineering as a major, and I chose to go to medical school because I thought of that as a natural transition and a way to bring some applicability from engineering or biomedical engineering to medicine. Went to medical school at, where I grew up in West Virginia.
Oh, nice.
And had some exposure to neurosurgery. I knew I wanted to be a surgeon of some sort, but once I got introduced to neurosurgery, I really understood that was A, the hardest training, and B,
I was gonna say,
it's the hardest training, which I was definitely that was definitely something for me. Because everyone's like, well, you can do this, you can do general surgery, or you can do that, but really nothing is more grueling than neurosurgery training. And I was like, oh, sign me up, sign me up for that one.
Oh my God, you like the challenge.
Yeah, so once I heard, and then, to see the kind of surgeries they did and what I got to experience as a medical student, I knew that was for me.
Nice.
And I was fortunate to get the opportunity to do my neurosurgery residency. Residency is the sort of specialty training you do after medical school. I did that and my fellowship at Jackson Memorial Hospital in the University of Miami. Jackson's one of the largest county hospitals in the country. So great experience,
I'm sure.
Phenomenal place to train. And then about 7 years ago, after I graduated, came up here to Boca Raton.
So were you one of those little kids who liked to as a child, do all these little things with your hands and play with these Legos? Because it sounds like you were up for the challenge.
I mean, I wish I could say, there's a lot of the stories of kids knowing when they're really young that they tell their parents, oh, I wanted to be a doctor, but that definitely wasn't me. I had no clue.
Were you good with your hands, at least, is what I'm thinking,
Probably not.
Really?
And even worse than that.
That's so funny.
I had a pretty bad, when I was little, I would pass out at the sight of blood. So,
oh my God.
So I'm pretty sure if you would ask my parents, they'd be like, "There's no way he's stepping foot in a hospital." But
wow.
Things change as kids age, and so.
And, and you challenged yourself, so.
Yeah,
good for you.
but if you had asked the 10-year-old me, would I want to be a neurosurgeon, I would have been like, absolutely not.
Interesting.
Yeah.
So tell us about the Marcus Institute. I mean, it's such an amazing institute. Tell us just a little bit more about what you do there.
The Marcus Neuroscience Institute, named after Bernie and Billy Marcus. Bernie Marcus, one of the founders of Home Depot, made a large philanthropic gift, I think in 2014.
Okay.
And really his vision was to build one place where people could come for both clinical and hospital care for both neurology, all the neurosciences, neurology and neurosurgery, and have that housed all in one place.
Wow.
That's the kind of co-location that you usually find in like large academic centers. But, you know, when you look around Palm Beach County or even places like Broward County or whatnot, there's really no large academic center there. So a lot of that expertise just is in the hands of individual physicians. So he really wanted to bring that into one place, one hospital.
What a vision.
Yeah, he's a pretty smart guy. I had the opportunity to meet him a few
Did you?
times. He's incredibly inspiring. Yeah, he unfortunately passed recently.
Yeah.
But he had a pretty incredible vision for what he wanted to bring to the community where he lived.
Of course.
So that was originally what that was, and what that's developed into is, you know, a large, there was a building, you know, that he funded along with some other generous donors that was part of the hospital. And what that is dedicated clinical space, dedicated research space, and then dedicated like intensive care units and operating rooms and all of that.
Wow.
Really for neurosurgery and the neurosciences. So it's pretty phenomenal. You know, he has a foundation so that the generosity continues, and so that his vision continues, I guess, is how I put it. But what it really allows us to do is to sort of put a really focused effort into treating what we would consider the breadth of neurological disease all in one place.
I like that, and I say what a vision, because to have it all in one place, like back then, I think he was probably one of the first people to do that, because that's what everybody wants to do now.
Yeah, there's a lot.
One-stop shop.
Indeed, and there's a lot of like synergy. It's hard to it's hard to articulate, but there's a lot of synergy from co-locating a lot of people who work in a very similar field.
Right, yeah.
So the fact that there's, you know, 8 neurosurgeons, or, you know, there's more than 10 neurologists, and they're all sort of together, it really does end up having a lot of patient benefit.
I believe that. For patients, everybody benefits. You as the doctor, they benefit, because I like that. Very, very amazing. So tell us, because I know you deal with, you're the director of the stroke program. So let's talk about, you know, what are the most common warning signs of a stroke that people often miss? If you want to share with us a little bit about that.
Yeah, stroke's a pretty common. It's one of the most common and one of the most disabling diseases. It's a little different. You know, what I always try to compare it to is a heart attack. I think a lot of people have what they have seen on TV or what they know from the media about a heart attack. You know, crippling chest pain, left arm pain, and for a lot of people, they get an impending sense of like doom. They get some sort of sense that something really bad is happening to them.
Really?
And when you contrast that with a stroke, it's extremely different. What people can typically have are some localized symptoms, and I'll say this multiple times, is we try to use an acronym called Be Fast. Those symptoms could be problems with your balance, problems, that's B. E is for eyes, so blurry or double vision. F is for face, so like a facial droop. A is for arm, so arm weakness or not able to use your hands. S is speech, so that's difficulty understanding what people are speaking to you, or difficulty speaking. T means time to call 911. But any of those symptoms, or any of them taken together, they're painless, and they don't have that really impending sense of doom associated with them, if that makes sense. Yeah. And so people tend to like brush them off. They say, "Oh, my arm's working. Oh, my face is drooping a little, or, you know, I'm not able to eat as well, or something." And they just tend to say, "Well, maybe it'll get better."
So was that like a mild stroke, maybe?
Who knows, right? It could be portending something extremely dangerous.
Sure.
But my point is that for even more aggressive symptoms, like maybe someone's arm isn't working well, because there is nothing else there, then there's no pain associated with it. People tend to maybe mistake that as not being concerning. So that's one of the most important things to impart to people is that acronym of all the things that they need to be that they should be aware of. B, that it really deserves a phone call to 911. They shouldn't drive themselves to the hospital. They shouldn't have a loved one drive them to the hospital. Right. And C, that just because they don't feel pain, it's not something they should dismiss.
Understood. Let's discuss how important is time when it comes to stroke treatment, and what does time is brain really mean?
It's pretty simple, you know. Stroke is a large umbrella term. It has a lot of different diseases that fall under that. But about 80% of stroke is the type of stroke where a clot comes from somewhere else in the body, and it gets stuck in sort of one of the arteries of the brain.
Oh.
So if you think of the arteries of the brain like a tree, you know, the clot goes up there, goes into one of the branches, and it gets stuck. And all of the leaves or all of the downstream part of that don't get enough oxygen, they don't get enough blood flow. And if that's not sorted out quickly, that part of the brain will have irreversible damage, and that brain tissue will die.
Yeah.
Those cells will die, the neurons will die. So that's the most common type of stroke. And what we know is that, you know, every minute that a stroke happens, you know, there's billions or millions of neurons that are affected. So that's why time is critically important, is because these cells cannot survive very long without oxygen. And so unless something's done, unless that clot's broken up and that blood flow is restored, then that part of the brain tissue will have some sort of irreversible damage.
So just curious, how is high blood pressure and stroke related? Is that the condition to stroke, or is everyone different?
So again, stroke's kind of this generic word. You know, the type of stroke that's most common, what we call ischemic stroke, the clots that go and get stuck, you know, those can happen for a lot of different reasons. High blood pressure is certainly something that can predispose people to things that will cause stroke, but there are other things that can lead to that. And in general, the things that are bad for the arteries of your body are bad for the arteries that your brain. So the overlap between the risk factors for heart disease, a lot of those overlap with the risk for what we call cerebrovascular disease, which is the blood vessels of the brain. So certainly high blood pressure is one. In addition, people with untreated high blood pressure also are at risk of having bleeding in the brain. So there's a different type of stroke they can have. So certainly high blood pressures can cause problems in multiple different ways.
I'm so curious, what is the difference between a stroke and an aneurysm?
Again, they're all, so stroke, again, this big umbrella. Big umbrella of things. There's ischemic stroke, which is the clots that can happen.
Right.
And then the other 20% of stroke are some sort of bleeds in the brain.
I see.
Like we talked about, some of those are those that happen to people with high blood pressure, but a smaller subset of those are people that have brain aneurysms. And an aneurysm is just a weakening of an artery, a weakening of the wall of the artery. Very simply, it almost looks like a ballooning, you know, of an artery. Sort of like if you squeeze a balloon and it has like a little outpouching to it, and that wall is very weak, and it just really becomes a sort of a plumbing problem or a flow problem. Over time, the high pressure arterial blood will continue to sort of damage that weakened wall, and the aneurysms can rupture. So when that aneurysm ruptures, it causes bleeding in and around the brain, and that's a type of stroke. Again, very different from the stroke that can be caused by the clot that comes from the heart that can get stuck in the brain.
Wow, there's
a lot to cover.
So many nuances, right, to that. So what are some of the latest advancements in interventional neuroradiology for acute stroke treatment? I'm sure you have the latest, so.
So interventional neuroradiology, so that's most of what I do now. So as a neurosurgeon, most of what I do is I treat blood vessel disorders of the brain. A lot of neurosurgeons, you know, they can do things from spine surgery to brain tumors, but at least at the Marcus Neuroscience Institute, we tend to subspecialize, meaning most of my practice is dealing with blood vessel problems of the brain. We have surgeons who do spine surgery, we have surgeons who do brain tumors, but you know, a lot of great literature out there shows that people tend to do better when they deal with people who are what we call subspecialists. So that's most of my practice, and nowadays most of that practice is what we call like catheter-based or interventional neuroradiology, meaning I'm not doing so much brain surgery anymore for people with these stroke problems. Most of the work that I do to help people is with a catheter, meaning
wow, how does that work?
The arteries of the body are like a highway. So you get on I-95, either in the artery of the wrist or in the artery of the leg, and then you travel up to wherever you need to go, even up into the brain, and you can deal with brain aneurysms or other types of strokes that way. So in terms of that field, which is also called interventional neuroradiology, which is really just putting catheters up into the brain, a lot changed in 2015 in terms of how we treat people. Before that, if someone comes in and they can't talk and they're having trouble speaking and they can't move half their body and they have a large clot in one of the arteries of their brain, there's not much we did for them. We maybe tried to give them some clot busting medication called TPA,
Okay.
Oftentimes that didn't work well. And
We have a quick commercial
Yeah,
break.
no
I
worries.
want to continue this conversation. We'll be
Sure.
right back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in, everybody. We are interviewing today Dr. Brian Snelling. He is a neurosurgeon and director of the stroke program at the Marcus Neuroscience Institute. The number is 561-955-4600. How lucky are we to have you right here in our backyard? That's amazing. I feel blessed that we have the best doctors and the best practices right here in our backyard. So just wanted to throw that in there.
thank you, appreciate that.
Yeah. So we were discussing before the commercial break, we were talking about the interventional and minimally invasive
Stroke
treatments. Can you continue on?
Yeah, so basically before 2015, stroke is the fifth leading cause of death and disability in the U.S. If you had a large clot that either came from your heart or somewhere else and gets stuck in your brain, we'd try to give you an IV medication. It usually didn't work well for very large clots. So big clots cause big problems.
Right.
Those medications work well for small clots, which cause small problems. So the big, life-threatening types of clots, we didn't really have a great way to deal with that. In 2015, some new technology came out where we could put a catheter up and go and grab that clot and pull it out of the brain.
Wow.
And it's evolved to the point where with people who are having those types of strokes, all we need to do for every two of those we do, one person's going to walk out of the hospital. And that's, in terms of effectiveness, that's probably one of the most effective surgeries or procedures that we do in all of medicine. It's as effective as giving someone antibiotics with a pneumonia, in terms of how many people you need to treat for somebody to have a good outcome. So it's been revolutionary, and we're really trying to catch up in terms of, in the US, we're trying to catch up to have enough centers and people to do this, because time is brain, and you have to have the doctor or the hospital where you are that can do this in order to save you. Because if it takes you 3 or 4 hours to get to the right place, there's probably not much to be done.
Sure. Wow. So what would you say to somebody? I may have somebody listening and they do have an aneurysm and they're just so fearful, and what would you tell them right now as far as how you would be able to help them through this whole process?
Yeah, I deal with that multiple times a day in my clinic. Brain aneurysms are pretty concerning. They're extremely common. Around 1 in 50 people has a brain aneurysm.
Interesting.
You're not born with them, but they form for reasons that we don't entirely understand. There is a genetic link there. They do sometimes run in families. but the vast majority of them don't rupture. Some of them do. And so part of my job is if somebody gets an MRI or a brain scan for some reason and we find an aneurysm before it ruptures, we have to figure out what to do with it.
Right.
And so a lot of that's depending on, how old the patient is, the size, the location, are they having any symptoms? And if they are and we think we need to treat it, then there's a couple ways. Like we talked about, traditionally we would do some sort of brain surgery where we put a titanium clip across the aneurysm and sort of remove clip it, which works really well.
Okay.
And it's sort of the mainstay of what we would do as neurosurgeons for this. But in the past 20 years or so, most of how we treat brain aneurysms has moved drastically away from that towards catheter-based treatments.
That's amazing.
So most of us who do this for a living are those of us who do both. So what we call neurosurgeons like myself, who do both the surgery and the catheter-based piece. There's so much new technology out there that has really pushed that whole field towards catheter-based treatment. So most of the people I treat, we're treating with catheter-based treatments for aneurysms. And people are pretty educated these days. They do their research online, especially in an educated place like Palm Beach County. And if somebody walks in for a consultation and you tell them they need to have brain surgery, they're gonna walk right out the door and go get it, go see someone else.
It's so reassuring to know that the technology in this field is really has really evolved.
Yeah, it's really
It's reassuring.
It's really mirrored. Interventional cardiology came first, in the 80s and 90s, and they really revolutionized how we treat heart attacks. And so, neurosurgery, we lagged a little bit behind the cardiologists, but now our whole field has sort of had a similar move towards away from open surgery towards that minimally invasive or catheter-based treatments.
That's amazing. Well, I'm glad that you said that, because I know people are listening that are wondering what to do. We'll make sure they go see you. Let's talk about the recovery process. What does that look like for patients? So maybe they are undergoing some interventional neuroradiology. What would that look like?
Yeah, it's pretty. So for a procedure, it's pretty easy. It's just a simple IV stick. So either in the wrist or the leg. Most people are, if we do some sort of brain procedure or aneurysm procedure, they're able to go home the next day.
Wow.
And the recovery is pretty minimal. It is minimally invasive from a recovery standpoint.
Okay.
What I always try to counsel patients is that they like the minimally invasiveness of it, but when we really look at risk, the risk sometimes is equivalent or it's not always a drastic difference between brain surgery and the
Really?
Yeah, it's not.
Just something about the word minimally invasive.
Yeah, it is. And people are like,
feels-
well, but I don't want the surgery. But for those of us who do a lot of neurosurgery, the cosmetic stuff I think really affects people. They don't want the incision. They don't want the hair shaved.
Yeah.
But for those of us that do that, surgery, as someone who has done it and does it, it really affords you a lot of benefits that sometimes you can't have when you do catheter-based approaches.
I see. And you would make that call, I guess.
Absolutely.
Obviously.
Yes. So what I'm trying to say is that when I see people in the clinic, they're always like, "Oh, I do not want that," but sometimes that's the best thing for them. And what I wouldn't do for them is say, "Look, I'm going to commit you to a procedure that has a higher chance of causing you a problem, just because it's less invasive."
I hear you. That makes sense. Totally makes sense. So what exactly is a subdural hematoma, and how does that usually occur? Is that what we discussed? Is that an aneurysm?
No, but
Okay.
it's a type of bleeding on the outside of the brain. It's a little bit of it's not exactly a stroke, but in some ways it's a problem that neurosurgeons have to deal with. And it's going to become more of a problem as our population ages.
Yeah.
What can happen is, as we age, our brain shrinks a little bit. It atrophies. That's just how things happen. And there's a little space between the brain and the inside of the skull. And when we have a fall, or for some other reason, if we're on blood thinners or something like that, we can have a small amount of bleeding or a small tear in one of the covering of the brain. And there can be some bleeding over time, and that can push on the brain. And it's usually not an emergency. Sometimes it is, but especially in older people or people on blood thinners, they can develop these blood or old blood collections under the skull on the outside of the brain that push on the brain. Yeah, and they're a real problem to take care of surgically. We can do a small hole and we can drain them, but sometimes they come back.
Wow. Wow.
And the reason it's a big deal is by 2030, that will be treatment of that problem will be the most common brain surgery that we do.
And is that from like a fall, like you said?
It's usually a fall. It's a problem. So the incidence of it increases with every decade of life. So, you know, it's sort of like you're exponentially more likely to have it when you're 70 than 60, 80 than 70. And a lot of that has to do with, one, the brain shrinks a little bit as we age. We're more likely to fall as we age.
Oh, yeah.
And then in addition, we're more likely to be on a blood thinner as we age for various reasons. So when you sort of tack all those three together, you know, it's a problem we can, especially in Boca, we see quite frequently.
I can imagine. I can't believe we only have a minute and a half left. This time has flown by.
I talk a lot.
No, amazing. So, last chance to kind of, you know, any shout out or any, you know, thing that you want to do, please do.
I would. The only thing I would tell you is this: there's two things I want to say. One is that, you know, like we talked about, if you think you're having signs or symptoms of stroke, definitely call 911.
Yes.
It saves time. It allows us to meet you at the hospital. EMS calls us in advance. And two, you know, I really do think that you know, at Marcus we really do have what I would consider a full package of care for all of all sort of neuroscience and neurological disorders, and pretty proud to work there.
Absolutely. I'm going to give the number out real quick one more time. You can reach him at 561-955-4600. Thank you so much for joining us today.
Thank you for
it was
having
a pleasure
me.
meeting you.
Yeah, take care.
Take care.